The following video is the opinion of Danton S. Dungy, MD. It is not medical advice. It is the tool that he is providing for his current and future patients. It is meant to serve as a review of the common concerns brought to Dr. Dungy's attention over the years. This video is not designed to diagnose, cure, or recommend treatment for any medical problem, nor is the video all-inclusive of the medical opinions of other surgeons. Equally, the opinion expressed in this video may not be relevant to your specific condition. Dr. Dungy is giving a general overview and would recommend that you schedule an appointment if you would like further information. For additional contact information, visit his website at dungymd.com.
Hello, Dr. Dungy here from the Dungy Orthopedic Center. This video short is about the hardest thing about knee replacement surgery. Now you may think that I'm going to have a technical answer, but the reality is the hardest part about knee replacement surgery is the commitment to rehabilitation through physical therapy and the overall recovery. Unfortunately, I have no control over the outcome of therapy. It is all up to you as the patient. You have to be highly motivated to do well. As soon as surgery is over and I tell your family how well you've done in surgery, how successful things went, and how bad the arthritis may have been, my job is essentially done, assuming that I get you safely out of the hospital and you have your pain well controlled. The recovery can be difficult. There will be days that you wish that you didn't have this done, and other days that you just wish you had your old knee back. There will be days that you will say this is the worst decision you ever made. Some patients can even become slightly depressed for a few days because of the intensity and constant nature of the discomfort. If you've ever had a cut knuckle, then someone asks you to bend it, you may find yourself thinking, there's no way it's going to heal if I keep bending it at the incision. Well, your knee is just like a big knuckle after surgery, and the therapists are going to insist that you bend it to gain normal motion and function. They will also encourage you to straighten it as much as possible. Every time you work with the therapist to bend it, and straighten it, it will hurt. Sometimes there is swelling involved too. To counteract this, I encourage you to use your pain medication prior to therapy. At least a half hour prior to any therapy session, I would recommend that you take your pain medication to make sure that you are adequately comfortable. There is a strong fear from patients about becoming addicted to pain medications. I will not let you get hooked on pain medications after this surgery. It is a necessary part of your recovery. The pain medications can cause constipation. They can also cause weight loss. They can cause decreased appetite. But the reality is, I want you to have a great outcome, and these medications are often needed to get these types of good results. There is a finite amount of time to work hard in physical therapy. It's approximately 6 to 8 weeks. If you don't put forth the effort and don't work hard during this time, you will not have any luck because the scar tissue will be too mature and you will be unable to gain any additional motion. So you have to push your hardest early on after knee replacement to gain maximal motion. Now, many surgeons and therapists emphasize bend it, but the reality is you also have to work on straightening it fully. If you're unable to fully straighten your knee, your muscles on the front of your thigh will have to be working all the time, even when standing still, because you will not be able to lock your knee out straight. With a knee that doesn't fully extend or straighten, you will fatigue quickly and have to sit and rest often. This will make you very unhappy when compared to a result that allows you to straighten your knee, lock it out, stand as long as you want, and enjoy the rest of your life. One of my goals is to perform your surgery so you have the potential to gain maximum motion. Another one of my goals is to avoid having to manipulate your new knee under anesthesia. This is where the surgeon takes you back to surgery and forcefully bends your knee in an attempt to break the maturing scar tissue. This is not a good experience, and we would like to avoid it. So, if asked again, what's the hardest thing about knee replacement surgery? It is clearly the recovery and physical therapy, of which you are ultimately in charge of your outcome. Be sure to visit my website for additional videos and information at dungymd.com.